both the babies as persons and the parents. I'm just really curious about whether that, those are connected.
This is actually quite a dilemma in a way, because of course we're there because of the children, and it's because of the children that we're in relationship with their parents, but it's the parents you're talking to, and so the relationship that you build is obviously with the parents, and so keeping that balance between relating with the parents so that you can have a worthwhile conversation about this child, and actually being there from the child's point of view, it actually can sometimes pose quite a dilemma, and I'm really very aware sometimes that sometimes the parents get, especially if they've got lots of needs themselves, the parents get most of the attention and the baby has to wait. And I've often asked myself, how long does this baby have to wait? I mean, it's only in retrospect. At the time, I'm so engaged with the problem in hand that I will be communicating with the parent. But I do often have to ask myself, how long does this child have to wait so it's for its parent to grow up, so that they can get their piece of the cake, if you like. So it's quite, I think it's instinctual, and I have to, I don't know whether it's really hard to know how I do that, but I know I've just done loads of clinics this week because I'm covering lots of people, so I've done about 5 clinics, and I know more than ever before I'm very much communicating with the child as well as the parent, and because the parents love it. I don't only visit babies, but we do start with babies. But the kind of with babies, you really have to work on connecting with them, because babies are quite often wary of a strange face, although they like glasses, so it's quite an asset having glasses. So I do have to learn how to be available to the child, but not overwhelming. And I learnt that to the hard way by being too much with the baby on occasions, and then you see them close their eyes or turn away or whatever. So I kind of learnt in tiny weeny ways which might not even be recognisable to me how I do that.
Yeah, and a phrase just struck me as you talked about having a worthwhile conversation.
What is a worthwhile conversation?
Yeah, I was just curious about
what it is.
How you think about that, because I would imagine that every individual is different, unique. We got a sense of
what a worthwhile conversation is. Yeah. Well, this is so complex, all this. Yeah. I am very much. I've always been. I believe. Is this really true? I think so. I'm going to stick with this for now until you prove me wrong. I try very hard, let's say, to be family-led. Even before it's now policy actually, but I've done it for a long time. So whatever they turn up with is what we do. Most of the time. There are times when I need to be proactive, but that's another story. So, through the years when we've had tick boxes delivered to us, we must cover these things, I've always been hopeless at that. And I sort of was ridiculous enough to feel guilty about not ticking the boxes. But I kind of knew, I've always kind of known that if parents had something that was on their mind, that's what we ought to be dealing with. That was the most important thing we should be. And very often that issue would lead on to the other important things anyway. One way or another, you'd cover the things that really matter. So I think that's it. It's about actually being there for the issue that they're bringing first and foremost, starting with whatever it is they want to talk about, and that's the worthwhile conversation, because they will want to be having it.
And does that extend to the project you did in Snow Hill with I think it was the Father's Art Group?
Yes.
Yeah. Does that family-led? That sense of worthwhile conversation?
They wouldn't have come. Those men would not have come to the arts project if they didn't want to be there. They are really, really good at avoiding putting themselves into places they don't want to be. Really good at it. And these, on the whole, were men who were already really quite considerably discouraged. There are men at home during the day who might not have felt all that good about themselves at times, and would want to avoid anybody who's a figure of authority. Anybody who's going to try and tell them, judge them, or tell them something. So anybody from health, education, they don't want to be taught stuff, or social services who are going to come down hard on them. They don't want to know. So I really needed to make a kind of relationship where I was showing myself not to be judging. This is a long-sidedness, big time this is. So that to be useful to them in some way, not be judgmental, to be accepting of things that are not perfect, to be seeing them as worthwhile, fun, useful, valuable to me, to the project, whatever. And it needed time. Trustworthy is a big thing. That I wasn't going to be shopping them to authorities for the things they might be, their failings, if you like. And actually I'm quite good at that. I think, I'm quite good at making those kind of relationships. And health visiting is such a privileged job, because we have access to families, because when they have little babies, you're going in regularly with their partners, because women are much more accepting of people coming in because they've had it all through their pregnancies.